Chapter 20, Vascular Anatomy, Screencast 2. So this screencast is going to focus on capillaries and veins, the last two types of vessels that we haven't really addressed to great detail. So the first that we're going to look at are going to be capillaries. And there are a couple things that I want to point out about capillaries that I think are especially important. One, they're very small. And I want to use this as an example. Okay, as far as average length, we're talking about 1 millimeter, and the diameter is actually 8 to 10 micrometers. So I want to get the idea out of your head that when we look at an image of a capillary bed, that's reflective of what it actually is, because it isn't. And that's an important thing for us to remember. Another way to image how small capillaries actually are, they have the ability basically to allow red blood cells to move in single file through a capillary. So that says something. And something to keep in mind also is when we're talking about capillaries, they're lacking all of the layers except for the intima, which is only just a endothelial layer on a basement membrane. But keep in mind what's important to remember here is they're designed for exchange, and that is going to be due to their thin wall, small diameter. It really maximizes their ability to perform their function. There are three general types of capillaries, and we want to think of continuous, fenestrated, and sinusoid. Now, continuous, I also want us to think thinking common. These are the most common of all capillaries. And I want to go back to AMP1 when you covered a number of different types of connections between cells. Now, tight junctions, it's important to remember, are not a perfect junction. They're going to be these intercellular clefts, and they're gaps between the endothelial cells of capillary wall. And things to keep in mind, things that are large are not going to be able to pass through. So proteins, for example, but smaller things, so glucose, amino acids, they're able to pass through the wall of these capillaries. And generally, once again, these are the most common of all capillaries, and we pretty much find them everywhere. Then we have fenestrated capillaries. So now we're looking at these cells have a continuous lining, but there's fenestrations or pores. And what's happening now, these fenestrations are going to allow the movement of smaller plasma proteins, but also some other particles. So it is important to remember here, wherever we're looking at fluid transport or if we're looking at filtration, this is where we're going to find fenestrated capillaries. The best example that I can give you is within the glomerulus of the nephron. Remember, the nephron is the primary functional unit of the kidney, and the glomerulus is the part of the nephron where filtration takes place. So there has to be pores. Then we have sinusoids, and these are basically, they have an incomplete lining with large gaps, an incomplete basement membrane. Now, these are going to allow relatively large particles to move through. So large proteins, formed elements. And if we kind of keep in mind where we find them, bone marrow. So remember, bone marrow is where formed elements are produced. So there has to be a way for them to make their way into the circulation or our vessels. Now, when we look at capillaries, generally you're going to hear them arranged or referred to as a bed of capillaries. And what we're going to look at primarily is going to be a medarterial, and that's basically going to be from the medarterial side, and it's going to connect to the venous side. And so that's an important thing to remember when we're looking at that. Kind of think of it as a thoroughfare channel. And then we have true capillaries, and these are going to be those vessels that are actually branching away or off the medarterial. And that's really what we're talking about as far as the capillaries we expect to find in a capillary bed. Now here we can basically see the medarterial, and once again, that's a thoroughfare channel. We have the arterial side and we have the venous side. And then here we're basically looking at the true capillaries. And the other thing that we're going to see here are these very, very small bands of muscle at the base. And those are known as precapillary sphincters. And one thing to keep in mind here is the state of this sphincter is determining whether or not a given capillary bed is going to be perfused. So if we think about what's happening here as far as vasomotion, this is a constant cycling, okay, and contraction of these precapillary sphincters. And at any point in time, only about a quarter of the body's capillary beds are open. And keep in mind, this is where perfusion comes into play. So it's the amount of blood that's entering capillaries per unit of time. Now here we can basically look at the differences between a capillary bed in which the precapillary sphincters are open versus one in which they're closed. If we look at the panel on the left, we can basically see that these are all open because this particular capillary bed is well perfused. Whereas here, we can see that there is no real perfusion occurring within the true capillaries. And so basically, we have blood moving through the medarterial from the arterial side to the venular side. Now, that moves us back into veins. And the smallest of veins are venules. And so we want to think of them as comparable to arterioles. And the smallest venules are going to be those post-capillary venules. And so they are the largest of the venules that actually have all three tunics, and they're going to merge to actually form veins. Now, veins can be small, medium-sized, and large. And when we look at the small and medium-sized veins, these are the ones that are companion to muscular arteries. The largest veins are going to be associated with the elastic arteries. And one thing to keep in mind here, when we talk about these veins, small, medium-sized, and large, they're going to be characterized by having valves. So think valves, volume veins. A lot of these are associated with veins. And so what these valves do, basically, they're going to prevent blood from pooling in the limbs, and they play a role in making sure that we're going to have good venous return. Now, these valves, they're actually found within the tunica intima, and it's really just these collagen fibers. And if we were to look at an example that we've seen previously, these valves are most similar to the semilunar valves we found within the heart. Now, a couple of things to point out here when we're looking at where blood is located. And I've used the term as veins are a volume reservoir. We expect to find the majority of blood within our veins. And this slide here really reinforces that. At rest, approximately 70% of blood in the body is within the systemic circulation. If we look at how that's distributed, 55% of that is going to be in the veins, only 10% is going to be in the arteries, and 5% is going to be in the systemic capillaries. If we look at the remaining 30%, 18% of that is going to be found within the pulmonary circuit, and the remaining 12% is going to be found or going to the heart. Now, one thing to keep in mind here is we've used this term reservoir, and blood can actually be moved from veins into circulation via the process of vasoconstriction. So a really good example of when this is going to happen is when you need more blood during exercise. So blood can be shifted back and forth. Okay, so at exercise, we're going to see vasoconstriction of veins, moving venous blood into circulation, whereas at rest, we're basically going to see that blood shifted back, and that's going to occur via vasodilation. Now, I'm going to skip the next couple of text slides and focus on the image, and that will be the last thing that we actually address in this screencast. And I want to put the emphasis here. So what we're looking at are a number of different paths and blood flow pathways. And so the first that we want to look at is the simple pathway. So this is really just an arterial, a capillary bed, and a venule. Now, let's look at these others. The first are going to be an arterial anastomosis, and look what we've got going on here. So we basically have multiple ways to get to the same capillary bed, but only one way to actually leave the capillary bed. When we look at a venous anastomosis, it's going to be the opposite. I have one way to get into the capillary bed, but then I'm going to have these branches that allow me to get back into venous circulation. We can have a shunt And what a shunt is, basically you completely bypass the entire capillary bed and you're going from arterial to venular side. This is not a medarterial because, once again, we're not talking about a bed of capillaries. They are completely bypassed. Then we're going to look at what we refer to as a portal system. And there are a couple examples here. We saw this terminology used when we talked about the hypothalamus and the pituitary as far as having a portal system. But probably one that's even more important is the portal system associated with the liver. And we'll talk a lot about that when we move on to the digestive system. But here, what we're looking at is arterial capillary bed. But the capillary bed is connected to another capillary bed by a portal vein. So here we have another capillary bed before we actually move completely into the venous circulation.